Hello, my name's Lisa Diaz. I'm a mum from Wigan and also one of the founding members of SafeEd4All. And for the best part of 2 years, we've been fighting tooth and nail for schools to be made safe. So here's a compilation of different people telling us why it's so important. Thanks for watching.
My name is Dr. Alex Huffman, and I'm a bioaerosol scientist and professor. Since the beginning of the pandemic, I've dedicated myself to research, teaching, and advocacy related to the airborne spread of COVID and its prevention. After all this time, it's hard to put into words how frustrating it is to see schools all over the world seemingly dismissing the spread of COVID amongst their students. Yet kids are getting sick at high and increasing rates in many places. Schools are letting the disease pass amongst students and back to their families, oftentimes without kids even knowing that they're sick or that they can be contagious. And huge numbers of kids are getting long COVID with symptoms lingering for months, and none of us know the real physiological ramifications of that into the future. The risks of COVID are real to our kids, and we've simply got to do better. It's also long since it's been crystal clear that the disease spreads primarily through the inhalation of aerosol particles and that are breathed out by infected people of all ages. What makes that frustrating and yet also so hopeful is that it means that we know the simple things that we can do in order to significantly slow down that spread. Encourage everyone to be vaccinated and boosted when possible. Yes, we should all continue to wash our hands and clean high-touch surfaces, but don't spend your extra energy there. Clean the air instead. Tight-fitting masks, good ventilation and room filtration, being careful at meal times when masks come off, moving activities outside, rapid COVID tests, and wise quarantine policies. We have all the tools at our disposal. It's critical for the lives of our children and our communities, but we've got to act. It's not too late. Spend some time soon to advocate to your local school leaders to encourage them to do everything in their power to take COVID prevention seriously.
Hi, it's Damo from Socialist Telly, of course lending my voice to support the call for mitigation measures to be put into place in an effective, meaningful way in our schools so we can actually start dealing with this COVID pandemic properly, because sadly that has not been the case so far. This pandemic has always been driven by airborne infection in the densest populated places in our society. And when you have, as is often the case, in excess of 1,000 people together in one building for at least 6 hours a day, how can that be anywhere other than our schools? Yet time after time, we saw schools being the last places to close, and the first to open. And as we've learned more about COVID and its transmissibility, it's become ever more obviously the case that children are affected, do pass it on, can suffer long-term with long COVID, do infect other age groups. The denials we've had from this Boris Johnson and the government have been shown to be a sham. Following the science, they always tell us, but as it has turned out, only the science they wanted to hear. Johnson wanted this virus to just pass through the population, to just take it on the chin as he watched COVID spread across Asia and Europe towards us last year. The JCVI, the scientific body advising his government, has supported that same herd immunity thinking and have decided our kids were the route to use. They've been guinea pigs for them, still advising against vaccinating 12 to 15-year-olds, even as the government eventually decided to overrule that, thinking not of the safety of our children, of course, but the vulnerability of the economy at the time, also a result of their cack-handed handling of this pandemic. Now, we cannot beat this virus as other countries have without properly protecting our children, who can get sick, of whom well over 100 have now died out of 160,000 UK deaths overall to date. How many of those deaths could have been prevented if we took the spread in schools seriously? How many more will we lose? Which of your family members might that be? Have you got vulnerable family members? Do you have clinically vulnerable family members that you're concerned about? We need masks, vaccination, social distancing, a return to distance learning for those who want it or in fact need it. We need proper ventilation, especially at this time of year when cases worsen, and an open window is the last thing you want. Support SafeEd4All as well and the tireless work this parent-led organisation does, and follow them on social media to keep updated. I'm immensely proud to host them on Socialist Telly, and we will continue to work together for as long as it takes for Johnson and his Tories to get real and stop playing fast and loose with our lives and those of our children.
Hello, my name is Colin Davis. I'm a professor of psychology, but I'm also the father of 2 school-aged children, both of whom contracted COVID before they had the opportunity to be vaccinated against it. This is a short message in support of SafeEd4All and their campaign, and a message as well to our government and the Department for Education and head teachers. And I have 3 simple requests. First, can we please stop pretending that our children are not being infected en masse at school? We all know this is happening, so let's just drop the pretense. And second, can we concede that this is doing children harm? Certainly, most children who contract COVID will recover and will be fine, but nevertheless, there is a sizable minority who will go on to develop long COVID. And it's not fair to subject children to that outcome when we don't know yet what the long-term consequences are. It's also not fair to put children in a position where they may inadvertently infect other members of their household, including vulnerable people, parents, grandparents. If those people go on to be hospitalized and worse, then that is doing harm to those children. And third, can we please have a sensible discussion about the mitigations that we could put in place very quickly and easily? Reintroducing masks in classrooms, ventilating schools better, speeding up the vaccination program for young teenagers. We might even have a discussion about greater government investment to improve the safety of schools. None of these things are radical requests. So I hope that we can have a grown-up discussion about how we can protect our children better.
Given their tendency to not seroconvert after infection, and also given that they have an excellent immune response to the vaccine, I think kids should be prioritized for the SARS-CoV-2 vaccination, especially considering the number of healthy life years they stand to lose from infection.
My name's Dominic Minghella. I'm a writer, a campaigner, and a trustee of the UK's new COVID charity, COVID Aid. Let me ask you a question. Are there air purifiers in our schools? No. Are there effective mask policies in our school? Basically, no. Are there bubbles? Remember those? No. Are there options for medically vulnerable kids, or kids who live with vulnerable adults, like me, by the way, to learn from home? No. Are parents being threatened with off-rolling or legal sanctions if they don't send their kids to school? Yeah, you bet. And it mightn't be so bad if we'd vaccinated our youngsters, but we prevaricated for far too long. And then we promised to vaccinate year 7 to 11 by half term, but it didn't happen. Just didn't happen. We managed about 16%. And the results have been catastrophic. Kids have been catching COVID by the truckload. They brought it home to their parents and their grandparents, 10,000 of whom have died since school restarted, in a wave clearly driven by unvaccinated school-aged children. And the kids themselves, they're not magically invulnerable. They've been getting ill. Some have been dying, and others have wound up in hospital. If you ask a friend to guess how many kids have been hospitalized with COVID each month in the UK, they will gasp at the answer. It's 1,000 a month. Imagine being the parent. Imagine being the child. The fear in the pit of your stomach, the dread. This abject failure to mitigate and failure to vaccinate has caused suffering and death. And it's not just not good enough, it's a disaster. Never was a disaster so literally unmitigated as the disaster of this Johnson government's back-to-school policy of autumn 2021. And winter, as they say, is coming.
It is not acceptable to unnecessarily and knowingly expose children to increased risk of infection. And schools must have a multi-layered, scientifically recognised mitigation system to prevent this from happening.
My name's Sarah and I'm from Nottingham. The pandemic caught me on a break from teaching with our third child, and I've been remote educating our children since March 2020. Between September 2020 and April 21, we were threatened with fines, prisons and ankle tags for remotely educating our children. This was despite providing evidence of all the work they were doing and having a vulnerable member in our household. In April 2021, we decided to remove them from the register. We wanted the children to go back and we thought changes had to be coming soon, but the threats of prison and ankle tags was just too much of a strain. And with Delta on the horizon and mitigations about to be reduced in schools, it didn't seem like change was coming soon enough. I can't believe that 20 months into a pandemic, schools are still unmitigated. Vulnerable families are still being bullied into school and there's no sign of change. We're a global outlier in all the worst possible ways. Schools are completely unmitigated. There's no improved ventilation, masks, vaccines are slow to roll out. It's just unfathomable, and it looks set to continue. My friend in Canada has got options of remote education as well as mitigations in the classroom. She says around 25% take up the offer of remote education. The only reason I can think that they didn't offer it in this country is because you take out that many children, herd immunity could no longer be a plan.
Hello, my name is David Tomlinson. I'm a hospital consultant and a founding member of Fresh Air NHS, a group campaigning for better protections against airborne transmission of SARS coronavirus in healthcare settings. I support the Safe Ed for All campaign, that in-person education should be safe, sustainable and fair to all during the SARS coronavirus pandemic. We know how this can be done. Other nations have made in-person education for children safer through a multi-layered strategy of face mask wearing indoors, useful to limit virus release during breathing, speech, singing, shouting, all the stuff kids need to do at school. Improvements to ventilation standards and using high efficiency particulate air filter units, HEPA, where necessary to clean the air. A reduction in airborne virus leads to a reduction in the risk of infection. And vaccination. Fully vaccinated kids, that's 2 doses, are far less likely to get infected. And of course, you can only transmit SARS-2 if you're infected. There's a huge amount to gain through introducing these measures. I shan't go into the numbers of children predicted to be affected by long COVID, hospital admission, paediatric intensive care admission and even death, because they're truly horrific. But it's not too late for our leaders to act. Please help make our schools the safe places our children deserve and need. Thank you.
Hello, my name's Hilda Palmer. I'm from the Greater Manchester Hazards Centre and the Hazards Campaign. Government policy is deliberately killing, sickening and disabling people, especially our children. It's all wrong, it's unnecessary. COVID is a preventable disease, and good public health, good infection prevention and good science tells us what works to prevent COVID transmission in schools. Better ventilation, 10 litres per person per second minimum, supplemented by HEPA filtration, source control masks for everyone, everywhere in schools, and PPE too. CO2 monitors to warn when ventilation is poor and the risk of inhaling COVID is high. Government policy of fake science, fake herd immunity, false dichotomy of profit before people is a disaster. It's criminally negligent and it's causing social murder or corporate manslaughter. The government must stop this vile biological warfare in schools and protect children, staff and all of us.
Hello, my name is Ali George. I've been a doctor for over 30 years and I'm mum to 3 grown-up children. To me, it is really very simple. COVID is airborne, we've known that for months. We also know how to reduce transmission and thereby reduce the risk of acute and chronic ill health, death and educational disruption, all caused by COVID. We also now have safe vaccines that are licensed for use in school-aged children. We are an international outlier. The decision to allow the uncontrolled, unmitigated spread of COVID through our schools, I believe, is willfully negligent. In my opinion, it breaches the UN Convention on the Rights of the Child and is also contributing very significantly to the total collapse of the NHS. Thank you.
Hi, I'm Steve from Squawk Box and I'm fully supporting Safe Ed for All's campaign to make the government put proper mitigations in place in schools to protect our children. The government is playing fast and loose with the safety of our kids. I have 4 grandchildren, they're all in school at the moment There are zero mitigations in there, no masks, no bubbles, none of the ventilation that the government's scientific advisors have said that they need. And we've had the scandal of this JCVI, the government's vaccination committee, deciding that the best way to protect our kids and the rest of us from infection is to let the kids get infected with the virus to achieve this so-called natural immunity, which is herd immunity by another name. And of course, as has been known since early last year, the schools are the vector for the virus. The schools are the place where the virus is most easily transmitted. It's not isolated among children. The claims that children weren't able to easily pass on the virus have been a lie all along. And those kids are taking the virus home and infecting their elderly or vulnerable relatives. And we are seeing a rise in cases and a rise in deaths. And directly for the children are being used as a guinea pig in this case, with no real idea of the long-term effects of this virus still, except that people do know that there are serious health implications for infection with the virus, and some that can affect kids particularly. Inflammation of the heart and long-term deleterious effects on our children. It's absolutely unforgivable. It's absolutely unconscionable. It's very simple for the government to do what it can to put in ventilation, air extraction, filters, etc. in the classrooms, to have masks in the classrooms if that's what the scientists say is going to work, and to do what other countries have done, which is to keep their kids safe from the virus. And in this country, it's just not happening. It's inexcusable. It must stop, and I fully support this campaign. Thank you.
This is a letter from Wigan Council. As you can see, there's the Wigan Council headed paper, basically saying if I don't send my daughter into school where there is COVID already, that I will face court proceedings. I can face a family court, which is particularly malicious because it implies there's a welfare issue, like I'm neglecting my daughter or she is under threat or something like that, and legal proceedings where I can get fines of up to £2,500. And this is because I am keeping my daughter out of school and I am teaching her remotely until it is made safe. That schools aren't safe is not a matter of debate. In fact, if I wanted to spread an airborne virus around through a population, I would stick 30 odd unvaccinated bodies in a confined space, in a classroom, without masks, without social distancing, with inadequate and unmeasured ventilation. Open a door and window, weather permitting, it is not enough. It's not enough against Delta, it's certainly not enough against Omicron. I would not isolate close contact, so your child could be sat next to a child whose sibling, mum or dad, is poorly, is at home with COVID. All of these things is creating a perfect storm for the spread of COVID. Now you might say, oh, but it's only the sniffles in kids. That is absolutely wishful thinking. Chris Whitty said it's not a benign illness in children. Fauci said children need to be vaccinated for themselves, not to protect other people, well, that as well, but to protect themselves. We've got 80,000 children living with long COVID in the UK. 13,000 of these children have been poorly for over a year. 115 children have died throughout the course of the pandemic of COVID in the UK, and there is nothing being done about it, nothing whatsoever. So this attack on a vulnerable mum, I don't think people realise how serious and how cynical it is. You know, it's like the expression, isn't it? First they came for the socialists, but I was not a socialist. And then they came for the Jews, I was not a Jew. And then they came for me, but there was no one left to defend me.
Hello. My name's Janet Newsham and I'm the coordinator at Greater Manchester Hazards Centre, and I'm the chair of the UK-wide Hazards Campaign. We're a campaigning organisation who advise on occupational health and safety issues. And since the beginning of the pandemic, health and safety law hasn't changed. Our employers, and that includes school management, have a legal duty to identify, assess and control the risks in those spaces, and that includes infection risks from COVID-19. It is gross negligence that they're not doing that, or that our enforcers aren't enforcing it. And certainly it's gross negligence that our government is operating a mass infection policy, which will leave children dead and others with long COVID. You have our full support. Thank you.
In any civilised and functional society, risks to the person are mitigated to the greatest possible extent, and this, as both our moral system and our biological imperative dictate, is even more true where our children are concerned. Medicines, toys and all other products, and not just those for children, but those that they can come into contact with, they're explicitly designed for safety. Isofix child seats, safety closures on household chemicals, holes in pen lids, age limits for certain activities, additional restrictions on who can work with children. You know, the list is endless. But the current UK child COVID strategy just seems to be to compel parents to send unvaccinated children to schools with inadequate infection control, presumably in the hope they'll acquire COVID immunity at the bargain basement price of free, except for those who suffer long-term illness or even die, but that, to quote Shrek's Lord Farquaad, is a sacrifice the UK government appears willing to make. You know, if any toy, product or medicine, especially ironically a vaccine, had a risk profile anything like this absurd and appalling strategy, parents would just reject it out of hand, and who could blame them? Well, I've had a good look round at the people who are reassuring parents that it's all perfectly safe, and I don't trust them. They have other priorities: the economy, political expediency, not losing face. Well, just like you, my priority is the children. Mine have grown up, and if yours haven't, you already know the truth in your heart. You can't be too careful. Demand more of the politicians you elected before it's too late.
Hi, I'm Sharon Honey. I've been advocating for parents and students since the beginning of the pandemic and making sure that they have what they need. This government does not listen. Parents' wants are simple. They want to drop their children off at school in the morning, pick them up at the end of the school day with nothing extra other than the homework for that evening. It's not difficult. Clean, filtered, fresh air in classrooms. Masks. Hand washing, hand sanitizer. Disinfecting desks.
Speaking as someone who's been following the COVID situation in the UK very closely over the last 18 months, and as a father of 2 children, I've seen firsthand how much our kids have sacrificed over the last 18 months. They've had their schools closed, their opportunities taken away, their education's been continuously disrupted, their social interactions have been limited, and their support networks have been damaged. And that's not to mention the human cost of having loved ones taken away by this terrible disease. This is why I find it so appalling that we are effectively leaving children alone to face COVID on their own in schools. We're not even doing the basics to mitigate spread and to make schools safer. And over the last half term, we've seen the consequences with hundreds of thousands of children catching COVID, getting ill, and having their education disrupted again. While such a high proportion of our school-age children remain unvaccinated, we need to be doing more to reduce the chances of our children getting infected with COVID in schools.
My name's Sarah Saul. I'm not an epidemiologist, a virologist, a healthcare professional. I'm simply a mum and one of the founders of SafeEd for All. All we've ever wanted, all we've ever asked for, is that in-person education be made safe, sustainable and fair to all throughout a global pandemic. It's happened elsewhere. It could have happened here. The simple messaging could have been, COVID is airborne. Everyone, regardless of age, gender, sexuality, ethnicity, occupation, can contract. Everyone can transmit. And don't forget that nobody can guarantee with this novel virus, which is not yet fully understood, nobody can guarantee how your body will react to an infection. Had those 3 simple things been communicated to the public, we wouldn't be in this mess right now. The Department for Education has failed twice, 2 separate academic years now, to issue guidance to schools that is based on scientifically recognised infection control principles. It's not rocket science. It has been done elsewhere. We have been left, our families, our school staff and our children have been left to unnecessarily and knowingly be infected. This is not right. This can't continue. This has to stop.
Hi, my name's Steve Griffin. I'm a virologist. I work at the University of Leeds. I research SARS coronavirus 2, but I'm also a dad, and I am speaking here both as a virologist and a concerned parent, and in full support of SafeEd for All and all they're doing to help children in education. I think it's saddening for me to see us yo-yoing between extremes throughout this pandemic, either lockdown or freedom, for example, and now we're seeing that in schools. We're seeing complete and utter control and restrictions and closures, and now we've got absolutely no protection whatsoever in terms of essential mitigations, and of course our vaccination program in children is far from complete. This is where the infections are. This is where the prevalence is being driven by. This is how the infections are making our children unwell, including very severe disease. It's causing long COVID, but it's also the engine that's driving infections across the country. It's finding those vulnerable people. It's driving the need to boost our vaccine program because the level of infection in this country is so high. It's a crying shame that we didn't act during the summer to protect the children properly with vaccines that are safe and effective and excellent at preventing this virus doing what it does. And I would encourage the government and the JCVI, as soon as the vaccine is approved by MHRA in 5 to 11-year-olds, to review this case urgently and not take the amount of time that we saw for the adolescents. The simple fact is that this virus is not characterized, we don't understand it properly. To let it pass through our children with the anticipation that they won't A, be harmed, and B, will develop a proper immune response to contribute to herd immunity and indeed stimulate adult immunity is wrong, it's flawed, it's a Great Barrington-based myth. We need to protect our children through vaccination. We need to do this urgently. It's also a dangerous thing to do to allow a virus to tear through a partially vaccinated population from a virus geek perspective. Let's not make another Delta, because the future at the moment needs to be brighter. It needs to be made safe by our vaccines because they are our way through this, but we must not accept this perennial harm that we're experiencing along the way. So thanks, SafeEd for All. I hope the message comes across.